Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. What is the picture that comes to your mind when you hear the words Alzheimer's disease? I'm willing to guess that for most people, it's a picture of an older person, maybe a grandparent. This person has begun to lose elements of their memory, perhaps, and that loss is making it harder to complete daily tasks, things they used to do so well. My guest today, Craig Ritchie, wants you to know that that picture of Alzheimer's, where symptoms are present and are altering a person's life in major ways, is what he calls Alzheimer's dementia, and it's different from Alzheimer's disease in some very important ways. Craig Ritchie, as it happens, knows what he's talking about. He's the CEO and founder of Scottish Brain Sciences. He's a renowned Alzheimer's researcher, and he's also a member of StartUp Health's Alzheimer's Moonshot Impact Board. According to Craig Ritchie, Alzheimer's disease can be invisible and can present in younger, healthy-appearing people.
Now, when I think about Alzheimer's disease, I think about, dare say, somebody like me. I might have Alzheimer's disease. I'm 55 years old, and I might be having those early changes in my brain.
In order to slow down or even cure Alzheimer's, says Ritchie, we need to bring more focus and do a lot more research into this population who may have the disease but have yet to show signs of dementia. That's easier said than done, however, since it involves tearing down some older ways of thinking.
We're actually unlearning a lot of things.
Yeah, that makes sense.
that we took as sort of mandated and truths about dementia, which may not necessarily be true early in the course of disease.
In my conversation with Craig, you'll learn more about the current state of Alzheimer's research and hear why Ritchie is optimistic about what can be accomplished by a community of innovators like the one we've formed through the Alzheimer's Moonshot.
This is a huge challenge, but it's totally surmountable.
Yeah.
But it needs this coordinated action. Not one group, not one company, not one academic is going to cure Alzheimer's.
I left this interview feeling encouraged about the near-term future of Alzheimer's innovation and about the possibilities of our Alzheimer's Moonshot. Much more to come on that front in the weeks and months to come, so stay tuned. In the meantime, let's get into the interview. Craig Ritchie, thanks for taking the time with me today. It's very exciting to have you on the Alzheimer's Moonshot Impact Board. You bring a wealth of experience, and so today I want to learn a little bit more about you, the work you've done, and kind of what some of your hopes are for the future, not just of our Alzheimer's Moonshot, but just of research and innovation within Alzheimer's in general. So great to see you today.
Thank you. Thank you.
Remind us where you're calling in from, because I think that's part of this sort of global conversation.
Yeah, so I'm based here in Scotland. I'm CEO and founder of Scottish Brain Sciences, but I also have an academic position at the University of St Andrews. And right now, I'm in my office in Edinburgh, which is the headquarters of Scottish Brain Sciences.
How long have you been in brain health and neurodegenerative diseases?
Yeah, I mean, I trained as a psychiatrist. I graduated from medical school in 91, trained as a psychiatrist, but I think my first real exposure to Alzheimer's disease, neurodegenerative disease, was in 97, when I was fortunate enough to work with a guy called Colin Masters, who's a professor of neuropathology at the University of Melbourne in Australia. And I spent 4 years working in Melbourne, really helping in many ways the work that he was doing in identifying new targets for Alzheimer's disease. And I did the drug discovery bit, the drug development bit, I should say. And that was kind of the launch pad, if you like, for my interest in this area. And I think what we've all learned over these last few years is that a lot of the drug trials that were taking place, 20 years ago weren't successful because we didn't really understand enough about the disease, particularly in the earliest stage of the disease, which we now know to be 20 odd years before symptoms develop. So I was fortunate enough about 10 years ago to start leading some pretty big cohort studies. And those studies were really illuminating in terms of looking at risk factors for later life dementia and brain changes that take place in people in their 50s and 60s. And a huge amount of data has come out of that, which I think in the end of the day is going to help us understand the disease, find new targets, better treatments, earlier detection. And, I still believe that if we can pick these diseases up early enough, we can cure them.
Yeah.
And that's what motivates me.
Part of the goal of this channel is to translate some of the great work that's being done to a consumer audience, to folks, I guess, just who aren't academics, who aren't in Alzheimer's
Sure.
research. So help us understand what the current best understanding of, you just mentioned, just understanding of the disease has shifted a lot.
Yeah.
So understanding the risk factors, I guess we could start there,
Mm.
the risk factors for Alzheimer's.
Well, one of the things to think about is this distinction, which I think is really important between Alzheimer's disease and Alzheimer's dementia. So, generally speaking, I think the public and a lot of, dare say, experts as well believe them to be synonymous. They're the same thing.
Okay.
They're not. You know, Alzheimer's dementia is a clinical syndrome that takes place in later life predominantly, and it's defined by symptoms, memory
Got it.
problems, mood symptoms, behavioral problems, etc.
How most people envision Alzheimer's.
Exactly. If I just walked into a room and said Alzheimer's,
Hmm.
what do you think about? You would immediately, I think, most people would think about an older person who's needing a lot of support. They're forgetful. They're maybe getting lost, or maybe their driving ability is going down, etc., etc. Now, when I think about Alzheimer's disease, I think about, dare say, somebody like me. I might have Alzheimer's disease. I'm 55 years old, and I might be having those early changes in my brain, which, if left unchecked,
Mm,
would develop dementia in 15, 20 years' time.
interesting.
Now, what we know, what we understand about, let's just call it Alzheimer's at the moment, until very recently, has always been through investigating people with a dementia syndrome.
Got it.
So risk factors for dementia, cardiovascular illness, heart disease, I should say, or diet and smoking and alcohol. From lots of studies over the years, we've developed this notion of what are the risk factors for dementia. And they may well be the same as the risk factors for disease, but they're not necessarily the same.
Interesting.
So when we do these studies, like I mentioned earlier, PREVENT and EPAD, and the PREVENT study looks at 40 to 59-year-olds. The EPAD study looks at everybody over the age of 50. So you're beginning to pick people who are ostensibly healthy and look at their brain, and it might be different risk factors. Different risk factors might have different impacts on changes in the brain that we measure through brain imaging or through blood sampling or spinal fluid. So we're actually unlearning a
Okay.
lot of things
Yeah, that makes sense.
that we took as sort of mandated and truths
Yeah.
about dementia, which may not necessarily be true earlier in the course of disease. And we need that knowledge if we're going to treat people earlier. You need
Yeah.
to know what the targets and what's the, how do you manage risk factors, how do you manage comorbidities, etc. So I think unless you do the science in the
Yeah.
in the people where this is most relevant, i.e., the younger people, then you're never going to have that knowledge to make informed decisions.
Well, you bring up an interesting point, which is about the role of early detection. I feel like it wasn't, if my understanding is that it wasn't that long ago that early detection wasn't a priority because there wasn't a lot we could do for someone who
Sure.
maybe we caught it early. And my sense is that that's shifting. So, kind of where are we at in the value of early detection of Alzheimer's disease?
Yeah, I think there's a really great debate to be had on that point about early detection. I sometimes get quite animated and resistant to the notion that what you can do about it is only a drug treatment,
Mm, sure.
because there's so many other things that people maybe could or should do if they have early disease detected. So there's lifestyle changes, there's managing comorbidities. But probably most importantly is that people with high risk, because of I do a lot of work with former rugby players, and they've obviously been involved in contact sport, and there's all this association between contact sport and that, and later life dementia. That these people are saying, do I have a problem? Or if they've got early symptoms, what's wrong with me? Now, I wouldn't sit there and say, well, we don't have any drug treatment for this, so I'm not going to try and answer your question.
Yeah.
I would move heaven and earth to answer that question.
Yeah.
So I would say, if somebody says what's wrong with me or what's my risk or, is there something I should be worried about, then I will answer that question. And that question could involve blood tests, it could involve, cognitive evaluation, good history taking, but it doesn't have to wait for a drug to be available.
Yeah.
Now that there are drugs available, that again, in some ways is a great catalyst and an amplifier for what we should have been doing anyway. Which is, people, there's lots of diseases in medicine that have no treatment, but people still want to know what's wrong with them. And the first step is actually answering that question, irrespective of what you can do about it.
And like you said, treatment doesn't just mean pharma.
And of course.
Yeah.
And also you have a lot of people who, we think that probably if you take somebody with what's called subjective cognitive disorder, so they've got a sense that something's not quite right with them. If you look at those individuals, the vast majority don't have a neurodegenerative disease. They've got anxiety, they've got depression, they've got other issues. So in many ways, detecting disease is important, but also is not detecting disease.
Yeah.
So if those people don't have amyloid or they don't have tau or they don't have any changes in their brain associated with neurodegenerative disease, that's incredibly important information, because then you can start working with them on what is actually causing their concerns, which might be depression, anxiety, other factors. So
there you go. You're pulling from your psychiatry. Was it psychiatry or psychology?
Psychiatry, yeah.
You're pulling from your psychiatry background there and recognizing,
exactly. We call them functional cognitive disorders.
The whole person,
exactly.
And how it contributes. Let's talk about innovation a bit. We're having this conversation because of this Alzheimer's Moonshot, because the idea is to bring together researchers and founders who are on the cutting edge, creating new, not just treatments, but also, care pathways and just ways of helping caregivers, et cetera. So tell me what you think is the state of innovation for Alzheimer's right now. Is it just kind of a long slog, or do you see kind of an uptick in what we're capable of doing?
Oh, look, I think there's definitely a moment here where the science has matured to an extent. The conversations that we're having are the right conversations. The ambition of the scientists, the expectation of the public is all coming together in this moment to say, we can do this. I think, to be fair, it has been driven by successes with pharmacology, with drug treatments. I think, other huge moments for the field have been blood-based biomarkers. To get a blood test for Alzheimer's, and over time we'll have blood tests for other neurodegenerative conditions. So this is a different world to the one we lived in the 20th century. I think everyone's embracing this expectation. I don't even call it hope, this expectation that we're on the cusp of something amazing. We've seen such successes in HIV 20 years ago. We obviously saw incredible successes that medicine achieved with vaccines for COVID. I think, this is a huge challenge, but it's totally surmountable. But it needs this coordinated action. Not one group, not one company, not one academic is going to cure Alzheimer's. You need to foster and amplify this expectation, this hope. But you need to make sure that we're all rowing in the same direction.
How would you like to see that coordinated action play out? It's one of those nice sentiments, and yet when you're an academic, maybe in a lab, it's a bit more challenging to, whether it's share data or to align yourself with someone else and encourage them. Like, how would you like to see coordinated action?
I'll take a step back before I answer that, because I think one of the things that, and I've obviously had conversations with leadership in StartUp and on this Moonshot. And I think, one of the things that's critically important is you call it a moonshot, because that was obviously a huge moment in human history to put a man on the moon. But it was a very clear target: man on the moon. 4 words. What are we trying to achieve with Alzheimer's disease? And the chair of the Moonshot once said to me, there's a quote from, I think it was George Harrison, if you don't know where you're going, every road will take you there. And I think one of the first things to be able to do is define is what is the goal? What is the moonshot? What is the man on the moon moment? And I think it's very clear, it's curing Alzheimer's disease. Now, how do you cure Alzheimer's? Well, you've got only got two things you need to do. You need to detect it early, and you need to knock back, you need to treat that disease. So now, within that program of companies who are and academics working on it, you need to agree, well, what part of that are you working on? Is it, if you're a diagnostics company, is it early detection? If you're a therapeutics company, is it a new target that's going to be effective early in the course of the disease? Because to be fair, you're not going to cure Alzheimer's disease when it's at the dementia stage, because the brain is,
Yeah.
unfortunately, so far advanced that it's just not going to be possible.
It's literally
So,
degenerated.
yeah, it's I mean, it's quite emotive to say this, but it's the palliative care stage of disease. It's
Yeah.
the disease has spread to an extent that cure is not really an option anymore. Whereas if you can detect Alzheimer's pathology, whether it be amyloidosis or the spread of tau, so early in its course, I think there's every expectation you can reverse, you can stop those changes. You might even be able to reverse it. So I think there's how do you, well, I think what you have to do is you have to get motivated individuals who are willing to share data, who are willing to share ideas, who are willing
Yeah.
to network their expertise, and recognize that we're all just part of something. We're no single group's going to be able to cure this on their own.
Yeah.
And I think that's what bringing people together does.
Yeah. It also makes me think about the role of entrepreneurs in a situation where we're sort of the public is expectant of a cure. Oftentimes the focus gets put on a large multinational pharmaceutical company. What do you feel like is the role of smaller companies, entrepreneurs, individual research teams? How do they play into this?
Well, I think number one, you have to, sign up to the vision. You have to believe it's possible. And then you also have to recognize that, taking the moonshot analogy, that your company might be, building the rocket booster. Your company
Mm,
might be providing the fuel. Your company might be providing the helmet on the
yeah.
spacesuit.
Yeah.
So no one company now is going to be able to provide the entire NASA.
Yeah.
I mean, I think we're 4,000 companies or something. There were
20,000, I recall.
20,000 companies were
20,000
going to,
companies, 400,000, no, yeah, a couple 100,000 people, 20,000 companies.
and it's the kind of the cliche where JF Kennedy spoke to the janitor at NASA in Houston, said, "What are you doing?" He said, "I'm putting a man on the moon." Each of those
That's
companies
perfect.
needs to believe that they're putting a man on the moon or they're curing Alzheimer's. Now, each of them isn't going to say, "Well, everything I do in my company, everything I do as an entrepreneur, everything I do in my academic group is going to be the end story." I'm not NASA. I am the spacesuit. I am the rocket booster. I
Yeah,
am
I love it.
the launch pad. I am the
Mhm.
communications director. I'm there's so many components of those companies, and we're just part of it, and we have to
Yeah,
accept that. Now
yeah,
we're going to most of those companies that were involved in NASA probably became very successful companies as a consequence.
yeah, yeah.
Rolex,
Goodyear was part of making the
Goodyear,
suits. Yeah,
so being part of this cure is probably still going to be not just for the value you bring in knowing you were part of the curing of Alzheimer's. You've also probably got a good, corporate,
yeah,
legacy on
yeah.
that. So,
All the
when
connections that come from that, all the sort of rising tide.
yeah,
Um,
absolutely, all the
Thinking
boats
about
go.
the Alzheimer's moonshot more specifically, I know we're only one quarter in. Have you had any reflections or thoughts over what you've seen in terms of the companies that have applied, or just the first couple of months of activity?
Yeah, no, I think it's been incredible. With as you say, just a few weeks into the program, and then the number of companies has been overwhelming in many ways. But I think also what's really gratifying is the diversity of the companies in terms of what they do. Whether it's diagnostics or therapeutics or care. I mean, I think, I've always got to be very careful that we don't forget there's a lot of people, millions of people, in fact, almost billions of people with lived experience, and we don't want to throw
Yeah,
the baby out with the bathwater.
yeah,
Of course, we want to get excited about getting a man on the moon. We want to get excited about curing Alzheimer's, but, in that 5 or 10 years before that happens, there's a lot of people with lived experience who need much better quality of care and
Yeah.
access to care. So, we need to maintain that work stream until we cure it, and we will.
Yeah.
But the other thing, which was, and I hope this doesn't sound a little bit sort of almost narcissistic, but it was, I've been working in this space for 25 years. And what was really gratifying was also there's a whole bunch of companies that I had no recognition of, and I think a lot of people who have lived in a particular bubble or echo chamber thought we knew everything.
Yeah.
And then you see these other companies and you go, wow, I did
Yeah.
not know that.
Yeah.
And that was just so uplifting to think, we know about the big pharma companies, we know about the companies who are in the public eye in some ways or go to the conferences, but to see these other companies that maybe aren't quite so visible, it's like you said earlier, bring that tide in, all these boats will rise. And I think that was for me to see things, amazing work going on outside of the echo chamber was just brilliant, absolutely brilliant.
One of the things I love about these moonshot initiatives is how truly global they are.
Mm.
Oftentimes, if you were with a sort of typical healthcare venture fund, you might say, okay, the U.S. market is sort of the largest and the most lucrative. That's where
Mm.
we're going to focus where the money is, right?
Yeah.
And when you pull back and you have a health moonshot focus, all of a sudden you get this amazing global
Mm-hmm.
conversation because that's, people
Yeah.
are brilliant and passionate all around the world. Here you are in Scotland. I know we've got a number of European companies, Australian companies. I mean, really, we draw from a number of places in terms of our applicants. And so I'm just kind of curious what role you think like a more global conversation has to do with Alzheimer's if folks are truly bringing a different perspective when they come together cross
Yeah.
border.
And I think, I mentioned, this echo chamber. There's always a risk that we listen to people who we've listened to before, or we enjoy listening to. There's a kind of familiarity. And in some ways that creates, what we refer to in science as confirmatory bias. You
Mm,
have this, you have a belief, what you're doing because
yeah,
you keep talking to each other and you fuel each other's belief system, and it might be the
yeah,
wrong belief system. So bringing people, like I said, other companies, other ideas, other thoughts into this and accommodating those and accepting them and valuing them actually means, oh, I did not know that. That's interesting. Maybe we
yeah,
should pivot. Or maybe that's, and I think not only is that sort of complexity and that diversity so important to probably get to the right answer, if that makes any sense, we've also got to recognize that Alzheimer's disease is a global problem. It's not a US problem. It's not a
yeah,
Scottish problem. It's not a Scandinavian problem. It's a global problem. In fact, we all know that the burden of disease is actually falling, more in low and middle income countries than it is in higher income countries. So whatever we do to cure Alzheimer's has to be globally applicable.
yeah,
So whether it's a diagnostic test or a therapeutic intervention or a lifestyle modification or an algorithm, whatever it might be, we have to make sure that those things work across the world
yeah,
and not just in where they're developed. I think it's realistic. It's a reality in some ways that, because of high economic areas having probably more companies, more investors, the reality is that I think a lot of these companies are going to be established initially in North America, Europe, Australia, Southeast Asia. But we almost have to, within the moonshot, say, well, what's your plans for globalization? And by globalization, we don't just mean opening up in new big markets, but making sure your tools, your therapies can be used wherever people are at risk of Alzheimer's.
yeah. I think that accessibility piece is a huge part of the global conversation because you
Mm.
get into one single market and it's about product market fit and just the revenue you can get from that market.
Mm.
When you start thinking globally, you have to think about
Yeah.
access. You have to think about cost, geography, and it just
Impact.
shifts your entire mindset.
It does, and I think, at the end of the day, how do we? It's quite. I mean, I'm kind of new into this entrepreneurial space. I'm only 18 months as a CEO, and I think, you have metrics, which understandably from an investment community and from a revenue perspective, you need to keep your company alive. You need to be able to grow, etc. but you've also got values around impact, which are maybe sometimes less tangible.
Mm-hmm.
But how do you know that what you're doing is having an impact? And for me, impact means, is it getting to the people who need this most? And we have to put mechanisms in place within the company, within our companies, to ensure that we're also valuing the impact that we have on society and healthcare. And I think, it's a bit of a cliche, but if you put purpose before profit, you will profit.
Mm-hmm.
If you put profit before purpose, your company will probably fail.
Yeah.
So I think these are attitudes, mindsets, particularly when we're working in Alzheimer's disease. We're not selling a product for, into a shop for, a coffee bar, or,
Yeah.
clothes shop. We're actually trying to cure Alzheimer's. So
Yeah.
the impact has to be, did we cure it?
What are you most excited about to accomplish in your own company over the next, let's say, 12 months?
I'd like to think that my company, Scottish Brain Sciences, will be a major player in this space. It sounds a little bit arrogant, but say with little components, I'd probably like to build the whole rocket, sort of thing.
Yeah.
But I think there's things that things that we're trying to do, which will have a major impact. But also, if I can, it's also maybe to take what I've just been talking about here and have a little bit of an influence in saying to other companies, other academic groups, that we can demonstrate the art of the possible, that what we do in Scottish Brain Sciences will be a motivator, that this can actually, because we need some wins, we need to have successes around, implementing certain things that we're doing. So I think that we're not necessarily a company that develops a single product. We're a company that's, helps enable other people to develop their products. So with what we do with the cohort study, the database we're generating, the biobank we're creating, that we can be an enabler of, we can be a scaffold in some ways for a lot of these other things to build off of. So I think if we're part of the Moonshot, if we're a big part of it, if we're an influencer, that would look good to me.
Yeah.
But also, at the end of the day, I'm a clinical academic, so I also want to produce knowledge, and I also want to make sure we help patients.
Yeah. We've talked mostly about the innovation around early detection and treatment. I wonder if you have any thoughts about the innovation that you are seeing or would like to see around caregiving and around just kind of where patients are today.
Yeah, I mean, this is,
Is there anything? I mean, is there?
oh, huge amount. I mean, I think there's the one thing I immediately think about is that there's a huge amount of resources, a huge amount of um, commitment from numerous sectors of society, be they, healthcare related, social care related, third sector related. But one of the problems I see, and I think a lot of care, products, are around how do people access all of these different resources. I mean, certainly from personal experience working here in Scotland, I'm hugely impressed by the number of companies or charities or institutions that are providing support. But it's very hard for a patient or a caregiver to navigate it,
Yeah.
and to know what's out there. So in some ways, we develop more products, if you like, for people with lived experience, but we've also got to make sure that they're somehow visible and accessible to people.
Yeah.
And that could be an algorithm, it could be an app, it could be a whole bunch of different things. And then there's, of course, the other part of this, which I think is really important, is how do we help people with lived experience to enjoy contributing to society as much as possible. And one of the things I think about is, as an analogy, people who, have, challenges with, walking or what have you, and maybe in a wheelchair, it's not that long ago that you didn't have ramps up into shops.
Right. Right.
Or you didn't have ramps in the pavement. So this was a huge impediment to people in a wheelchair to be able to get around. Society's still not very dementia friendly.
Yeah.
There's things that we could be doing that could help people to continue to drive, to continue to access And I think the world around us is not very dementia friendly and probably getting worse in some
Yeah.
ways because of all the stuff that's on this that we rely on so heavily.
Yeah.
And these things are actually really hard for people with dementia to use. You know, I remember, I know I'm going off from piece here, but I remember about 20 years ago being involved in a project where, everybody was, the banks were all closing. So you needed to use a PIN number to get your money out of the bank. People with dementia can't remember their PIN number.
Yeah.
Suddenly
I
they're
can barely
being
remember my PIN number.
well,
I
they're
don't
being
know.
excluded. So the way society is moving is actually excluding people with
Yeah.
lived experience rather than including them. And given the prevalence of this condition, I think it's something which we need to, companies can maybe help to develop solutions that maintain people's quality of life in
Yeah.
a society which is forever changing. And it should be changing with us, not against us.
I've read stories about these. Typically, it's somewhere in Scandinavia where there's like a little village that's been
Yeah.
created. How do you feel about those sorts of projects?
Yeah, no, I mean, I've actually had the privilege of visiting one of those outside. It was, I think, IKEA played a major part of developing such a community. I think,
As long as
I've
they
got,
didn't make the residents, assemble the furniture, then it's
yeah,
all good.
exactly. Well, yeah, that's not a diagnostic
That's the
test. I think
brain test. Yeah.
we'd all fail that one. But no, look, I've got mixed feelings about that. I mean, just at a personal level, is do you create these environments where people, elders, seniors, people with dementia live, or do you want them to continue to live in the communities they've always lived in?
Yeah.
Wouldn't most people I've met, dare I say it, in my clinical work, want to stay at home as long as possible.
Yeah.
And you're moving into a facility or what have you. And I can see both sides of the argument. I completely can. But wouldn't it be great if people didn't feel the need to move? People with cancer don't feel the need to move. People with other medical conditions don't feel the need to move. So why do people with dementia or a brain disease, have to, even though these places may be amazing and beautiful and wonderful, you've still got to leave your home.
Yeah.
And leave behind a lot of those memories and familiarities. So look, it sounds like I'm down on them, but I think there's also ways of trying to integrate and make.
Sure.
I mean, I remember reading somewhere, I think it was in Japan, where they looked at these houses they could build that actually almost adapted as you grow older. So they kind of, they actually have like dynamic housing. So they were super cool for somebody in midlife with young children, and then they were super cool for people who are older who need a bit more support. Smart homes actually adapted with. These would be interesting things.
Yeah. And it could be something relatively simple. It could be a modification that would mean a lot to you as you age, but wasn't some dramatic remodel.
Exactly. And I think, things like Alexa and other smart speakers are available. But I think, these are the kinds of things, these are the technologies that could maintain people in a community and environment for longer, because they allow you to have that familiarity, that connection with the outside world, with the speaking to your phone, speaking to your IT system is a lot easier than typing something in or working out what the app does and all these sorts of things. So I think there's a lot of technologies which can enable people to stay the best versions of themselves for as long as possible.
Speaking of which, last question, knowing what you know about brain health, is there anything that you do to kind of keep yourself cognitively fit?
Run.
Okay.
Run. Variety of reasons. Number one, tries to keep the weight off. I think, to stop eating is going to be a bit of a challenge. So I think running to burn the calories, but also it's great headspace. I run on my own. I don't listen to music. I just use that time to de-stress, and you can't be doing anything else while you're running. You can't be looking at your phone. You can't be answering emails. Yeah. So number one, run.
That's good. Yeah. Craig, appreciate the time. I'm so excited to have you on the Alzheimer's Moonshot Impact Board. I've already seen what you've brought to the table in terms of your passion and your knowledge, and I'm very excited to see what comes next.
Thank you so much, Logan.
All right. Wish you the best in your work.
Okay, thank you.
All right. Take care. Be well.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.